It's a fact. Vaccinations are especially important for infants and toddlers.
Our doctor has recommended that we get our baby vaccinated now.
I'm not sure if that's too early.
Many vaccinations are recommended for infants and toddlers at an early age. The first should be administered just a few weeks after birth. This is a reasonable time frame, as the recommended age for vaccination is based on the risk level of the child to be protected. Certain infections can have a markedly more severe course of disease in babies and toddlers than in older children. This is due to the narrowness of infants' airways, and they're still developing immune systems that cannot effectively fight certain infections, among other factors. Administering vaccines at the recommended time protects infants and young children from infections and potentially serious consequences. Many parents are particularly cautious when it comes to medications and vaccinations for their children. That is understandable. Young children's bodies, and those of infants in particular, are in the early stages of development. As a result, some parents have concerns about having their children vaccinated so young. However, early vaccinations are very important precisely because toddlers and infants are particularly vulnerable. For example, the pneumococcal vaccine, recommended after a child reaches 2 months of age, reliably protects against invasive pneumococcal disease. Children, especially those in their first 2 years of life, are at an increased risk of invasive pneumococcal disease. This disease is a particularly serious consequence of infection and can lead to other conditions such as meningitis.
Vaccinations protect infants and toddlers at a particularly vulnerable age. The recommended vaccines must be administered as early as possible to obtain this protection.